And the bottom line is that at every level, particularly for cardiovascular specialists, if we don't get involved, somebody's going to get involved for us.
We were actually improving care. We were actually improving the lives of our patients through this unique synergy and this unique collaboration.
That's what it's done over 20 years. It has done that business side of cardiology that I don't think a cardiologist in the country would be as successful if it wasn't for Midaxium.
When it comes to cardiovascular care on the organizational level, MedAxiom understands the challenges your program is facing. Welcome to MedAxiom HeartTalk, the podcast where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of MedAxiom HeartTalk. I am excited about today's episode, 20 years of transforming cardiovascular care together. This time of year is the perfect opportunity for us to take a step back and acknowledge the impact that the MedAxiom community has made over the past 20 years since its founding. So we are so honored to have today's guest, a powerhouse panel today, the tremendous trio, Dr. Ed Fry, Cathie Biga, and Dr. Jerry Blackwell. They have been a part of the MedAxiom and American College of Cardiology, ACC, community from the very start. To say they bring an incredible amount of leadership experience to today's discussion would honestly be an understatement. First, joining us from Indianapolis is Dr. Ed Fry, Chair of Ascension Health Cardiovascular Service Line, also the Vice President of the ACC. Dr. Fry is past president and governor of ACC's Indiana chapter. He has been a presenter, a moderator, and session chair of multiple ACC and MedAxiom conferences, also a member of HeartPAC, ACC's Political Action Committee. Busy man here. Next up, we have Cathie Biga, who is the president and CEO of Cardiovascular Management of Illinois. Cathie has more than 40 years of experience focused on facilitating the integration of strategic, financial, and quality perspectives between cardiovascular service lines of practice and hospitals. And last but certainly not least, we have Dr. Jerry Blackwell, the president and CEO of MedAxiom. Dr. Blackwell has a passion for physician leadership, teaching, and care transformation, particularly team-based care and organizational performance improvement. He maintains a clinical practice with special interest in advanced imaging. We could probably spend the entire podcast introducing our guests because they have such extensive experience and accomplishments. Many of you listeners know them well or have even worked with them in some capacity. For those who might be new to the community, we encourage you to read their full bios in the episode notes. So welcome to the podcast, Dr. Ed Fry, Cathie Biga, and Dr. Jerry Blackwell.
Thanks, Melanie.
All right, so the first question that we always ask Heart Talk a guest: why did you decide to get into healthcare? And did you ever have that aha moment early in your career? So Dr. Blackwell, we'll start with you.
Sure, it's multifactorial, as I'm sure it is for most folks. Actually, I was raised in rural Appalachia in a very small town in West Virginia where the primary care physician in the region had a big influence, not just as it relates to care, of course, but in the community at large. And so I was exposed at an early age to the influence that a single person can have over a large number of folks in a positive way. So there's no doubt that that had an influence on me. Also, my father, who was a PhD engineer and taught at a local university, and sort of helped me as well as my four siblings understand the importance of education, giving back to the community. Again, the notion, this sort of theme that one person can influence a significant number of folks if given the right opportunity and substrate. So I think those were the things that got me started. After I obviously was a little further along and able to think a little more clearly myself as I got into college and started considering careers, again, it was this notion of service. It was just that simple. Cardiology was even simpler because I was very much attracted to the physiology of medicine and the notion that we can help a lot of folks. So that's the thumbnail of my journey.
Started early, big shoes to fill, and I can relate because I come from a family of educators. So that's always in your mind. You hear that over and over again. You
Absolutely.
must excel. Yeah, Cathie, same question. What was your aha moment?
So, I'm a little older than my colleagues on the panel, and I was in that era of the baby boomers where you either became a nurse or a teacher.
Mhm.
And so I chose nursing. That's the honest answer. Never even considered being a physician. But my aha moment was during my undergrad work. My father happened to be the chairman of the board of a local hospital and invited me to a board meeting. And it was that, oh my Lord, who's making these decisions for us in healthcare? And so while clinical was very important to me, that was my aha moment about wanting to be an advocate for changing healthcare access specifically. Even back then, which I won't date myself, but there was a lot of activity going on for health equity and access to healthcare, and that probably was what spurred me on in my career.
Hmm. Cathie, I might argue that you still are that you are teaching.
Probably true.
Yeah, I think you somehow wrapped it all into one. Dr. Fry, what about you? What was that moment for you?
Well, when I was in high school, I actually wanted to be a graphic artist.
Hmm.
And but both of my parents were academic physicians trained outside the United States, and we had immigrated to the United States in 1963. And I'm sure through osmosis, I incorporated a lot of their interests and their desires and professional fulfillment that I saw that they both had. But I would say that it came probably in college when I realized that my interest lay in science, and that using science to be able to be applied to the human condition was really the nuts and bolts of medicine. And that's what really attracted me to it. And like Jerry, different influences each along the way in terms of going back to, making that next choice, that next decision. And I would say that bringing it full circle, my decision to go into cardiology was very much driven by my interest in graphic arts, because cardiology is a very graphic, very visual field, and it kind of all came together.
I love that. Wow. So you're getting to do what you love and your passion and helping others. So that's great.
Hopefully.
I would say yes. All right. So Dr. Fry, let's ask you this question, because in a Heart Talk interview back in 2013, you described the integration journey that your physician and hospital groups had just undergone. So you said this: we shared the vision of what we saw healthcare delivery becoming over the next 5, 10, 15 years, and that it was going to require a collaborative effort between hospital systems and providers. To do it separately would be counterproductive. You said the only way we could get to a point where we are truly providing the best care, the most cost-effective care, the highest quality care, is to do it together. So can you tell us more about what you meant by that and how your statement back in 2013 still applies to the Midaxium and ACC community today?
Well, I'd first start off saying that I think although for some this journey has been slower than they might wish, I think that we're still on track, and that in many ways we've accomplished many of those goals along the way. So I think we should be, as a profession, proud of that journey, and those who have entered into providing healthcare through an integrated approach should be proud of that. I think it's also transformed the way that independent practices have engaged in the healthcare enterprise as well. I think many of the same principles still guide them. But I would say that even more so today, the issue of collaboration, the absolute necessity for engagement of clinicians and the entire clinical team in the leadership process related to delivery of integrated care has never been more important. We're facing more and more difficult situations as it relates to the cost of healthcare, the access to healthcare, the equities of healthcare. Again, I think we can only really approach this and solve those problems together as a community.
It's hard to believe that we would do it any other way.
You raise a good point, but I think fortunately we've had the resolve to do it. And I think we've had some successes to prove that that is the right way to move forward. And I think more importantly is that it's created the model to encounter and deal with the problems that we know are going to be facing us ahead of time and those problems we don't know about.
Mhm. Yes, thank you. So Cathie, you've served as an influencer in the Midaxium and ACC community for many years, often quickly becoming that go-to expert for some of the most complex topics and challenges this community has honestly faced. So can you share how you first got involved in one example of how the community has impacted you?
Yeah, that's really a great question because I really owe my career to Midaxium in a sense. I was on the hospital side of things for many, many years. I was a hospital CEO when I decided to transition over to the dark side, as we say. And I had no idea how to run a practice. I could run a hospital with my eyes semi-shut. But a practice, that dark side that we always wondered about what the physicians were really doing over there. And this was at the very beginning of Midaxium. There was an organization, MGMA, which is a national organization, had a subset for cardiology. And then there was this very, very small group. And I still remember getting a phone call from Greg Timmers, who many of us know and love, who was down in Springfield with Jim Dove. And he said, hey, there's this group that's coming together. And we think that you would be a great asset to it and would serve a benefit for you. Would you be at all interested? On the sidebar, it also would offer me radiopharmaceuticals at a price that I couldn't get myself when I was running my own practice. So there was a financial link to it. And there it began. It began with a small group of us. I was member number 10. I wasn't number 1 or 2, but we were member number 10 of Midaxium. And what has it done? There is nothing that happens in the world of cardiovascular care that somebody in Midaxium can't walk me through step by step. There is not one issue that I can't pick up the phone and call a colleague that can help me brainstorm and bring it through. Everything from the advent of coronary CTA to the integration of our practices with the hospitals, all the way through this value world that we're working on right now. They call it the Transform now. We used to just call it the Midaxium meetings. We lived for the Midaxium meetings because we knew we would go home with 20 pages of things we had to do in order to make our practices and our physicians successful. That's what it's done over 20 years. It has done that business side of cardiology that I don't think a cardiologist in the country would be as successful if it wasn't for Midaxium.
That's great. It speaks to what Dr. Fry was kind of talking about, that collaboration, and how it just makes things so much better.
Yeah, the listserv, the one thing that listserv is our Bible. I'll look at a lot of things, but I always watch the listserv. It's that beating heart of the organization. No question is too stupid to ask, and the answers are always out there for you.
So good. The resources, it elevates everyone for sure. Dr. Blackwell, during a 2017 CV Transforum panel discussion promoting advocacy on Capitol Hill, you said this: there is nobody else out there doing it but us. If we don't do it, we're going to get nudged out for sure. It is a very unique position we find ourselves in, and we are the solution. So wouldn't you say that your 2017 statement that we are the solution still applies to most of the challenges that the Midaxium and ACC community faces now even?
What a great question. I love how you're pulling back these old things that could come back upon us. But on this one, it's really easy. I would say that what I said back in 2017 should be even amplified in 2021 and going forward. The notion of advocacy and how things are moved through the regulatory legislative process in all aspects of U.S. And specifically healthcare is a mystery to most folks. Most folks don't get the opportunity to personally participate in that. And I was afforded the opportunity to get exposed to the process. And there are a variety of ways that that happened, partially related to MedAxiom. And one is that the representative in the 1st District of Tennessee, Northeast Tennessee, where I currently live in the Kingsport Tri-Cities area, was a practicing physician, Dr. Phil Rowe. And so in an early, in the House of Representatives, and Phil had the distinction of being both a guy that literally practiced for 25, 30 years, also had some influence in the administrative part of our region and community, and then dedicated himself to service in the U.S. House of Representatives. And he actually sort of took me by the hand and helped me to see firsthand how the process that is involved in advocacy on behalf of those things that are important. So as it relates to the American College of Cardiology, the ACC has been very involved in advocacy, the location there in Georgetown on M Street, and has had a significant influence there. I was able to take my interest in the ACC, my knowledge, firsthand knowledge of what has happened here from Dr. Rowe, and harmonize those, and specifically to understand that you have got to be part of the solution, or else somebody's going to be come up with a solution for you. So it's that combination of things that allow me to understand that if you don't go ahead and get your hands dirty, understand how the sausage is made, and then be willing to make it, somebody's going to do it for you. I know it's a bit of a long-winded tangential thing, but it really is absolutely crucial. I will say as an aside, I've got a couple of, 2 of my adult sons are lawyers, one of whom spent time interning on Capitol Hill. And so I got to see it through another lens as well. And the bottom line is that at every level, particularly for cardiovascular specialists, if we don't get involved, somebody's going to get involved for us.
Yeah, I think what you all have in common when you're speaking is you started somewhere and you've just been able to grow. You've been able to grow so much and you know so much more, but you've tapped into each other to really grow that knowledge. So it's cool to see you in the spaces you're in now and to be able to share those stories from the beginning. So before we break, I have a 2 sides of the coin question for each of you. First, what has been your toughest challenge as a thought leader in the CV space? And then second, what has been your greatest joy? Cathie, I'll start with you.
Thanks, Melanie. That's a fascinating question, and I can't wait to hear what the others say. I would think I continue to say that I've never worked harder than I did in 2010, but that's a lie because every year I keep saying the same thing. But I do think one of the biggest challenges that I had was the integration of our group. And as across the country, as we helped people decide whether or not integration was for them, making sure that this wasn't about the money, that this was really about the collaboration and the governance of how we deliver healthcare and specifically CV healthcare. It was really a tough time. And it was hard to make sure that the vision that we were talking about, both at ACC and Midaxium, was a vision that had sustainability to it. And so I think as we sort of walked through that very difficult minefield, it was interesting to see us come out at the other end. And that's sort of what my greatest joy is. I think how we have come together as a cardiovascular community through this pandemic, as weird as it seems, has really sort of warmed my heart. How we've taken care of each other, how we have provided access to our patients, but probably more importantly, how the CV team has come together. And for probably, I won't say the first time, because I think we have struggled to come together and delivering care across a continuum with that team. But I think this environment and atmosphere has accelerated that. And as a nurse, I remember when I was granted the privilege of being on the board of trustees, being there as a non-physician was really an overwhelming feeling of gratitude that I could really help my colleagues in the CV team member really be represented at that highest level of governance. And watching that evolve, I think has just been really amazing. So it's been a great career.
I was going to say, I've heard that over and over again, and moderating this podcast, that pitching in and everyone kind of learning different skills so that they can help each other to get the work done. Dr. Fry, let me ask you, so your toughest challenge and your greatest joy?
Well, I would play off of that same theme. I would couch it in the term of engagement, both as a challenge and an opportunity. I think when the three of us came from pretty mature, well-developed, independent private practices, and in that environment, you necessarily, all members of the practice at the physician level and the non-physician level, had to be really engaged in the success of the practice and in the care of our patients. And so to be able to carry that forward then into an integrated delivery model, working with health systems or remaining independent practices and operating in a new healthcare environment, engagement is still the key ingredient. It's the secret sauce that has determined the winners and losers and those who have been successful or not successful. And even more so at the level of, in terms of healthcare advocacy, and in terms of the national societies such as ACC engagement is so key. I would say it's also been the greatest accomplishment because you can see as we mature in our careers, hopefully many years left for all of us, but looking forward, the greatest thing and the greatest reward I think we can have is to see to pass that message of engagement along to those who are coming along behind us. Mentoring people in terms of the importance of engagement and understanding that, just as Jerry said, related to advocacy, if we don't do it, somebody else is going to do it for us, and recognizing that we're in a position to be able to lead our own futures. And that's the definition of professionalism. The definition of professionalism is to be able to influence, lead, and optimize the care that you deliver in your profession. So I would say the two sides of the coin are actually the same thing, just looked at differently.
I think you're right. Cathie, you did the same thing, I noticed. Dr. Blackwell, tell us, and if you can think of maybe a story or something that happened where you can really reflect on that challenge and kind of that maybe connected feeling to joy.
Sure. Well, I will say to joy, again, I can play off both Cathie and Ed, who I've learned so much from each of them through the years. The joy is simply the profession of medicine and the gift that we've been given to subordinate our talents and our personal self for the benefit of others that we serve. And that is a common thing. That is a theme that runs through the profession that we're in. And MedAxiom certainly reinforces that. To the complexity or the challenge for me, and again, it's similar to what Cathie and Ed just discussed. It's this complex external and regulatory environment that we find ourselves in that many of us that have been on the practice side didn't know was coming. Most of us were just out there practicing cardiovascular medicine at various levels and various specialties, nursing, the physician side, many other sides. And then all of a sudden we get swept up into this complex regulatory environment and external environment. I'll give you a story that really just relates to the MedAxiom experience. And that is, again, although I've been doing this for over 30 years, MedAxiom is only 20 years. So as I got going in this, I was still fairly early in my career, and most of my work was spent doing clinical work, thank God. I mean, that's what I trained to do, and that's what I should have done. My group was one of the early adopters of MedAxiom. I was exposed to it. And all of a sudden, one day, I met people like Cathie Biga, who I didn't know from Adam, Ed Fry. Man, we could each give you a whole list of names. And I was sitting there listening and saying, man, there's a world out here I knew nothing about. And I must confess that I find myself incredibly attracted to folks that know stuff I don't. In the MedAxiom meetings, early on, I was exposed to folks that I thought, my gosh, they know stuff I don't know that are going to make me better. So I can give you some specific examples, but there's the broad picture of what's been most compelling to me over this past 20 years.
You know, Melanie, if I can maybe add to that, because you bring up Steve Gornick from Austin Heart. You talk about our meetings. I will never forget one of the first meetings he was at. We were sitting at breakfast doing our normal chit chat, and Steve just stops everybody and says, "Wait a minute, what was your aha moment?" And we're looking at him like, "What are you talking about?" He goes, "I want to know what your aha moment was from the conference." And listening to everybody, what was the one piece they were going to take home? And now every single Midaxium meeting, we say the same thing. What was your aha moment? What is it that's going to transform either your career, your daily work life? What is it? And for that, I'm forever grateful for lots of other things from Austin Hart, but that kind of insight from our colleagues is invaluable.
It's interesting. I was listening to another podcast this morning, and they were talking about, through life, there's a time in your life where you have a ton of mentors, and then you reach a certain point where you are the mentor. So to still be at this point in your career and still have others that you're learning from and growing from, that's pretty significant and a wonderful space to be in. All right. I think now is a good time to take a break. So we'll be right back. You hear the term care transformation a lot, but what does it mean exactly? Care transformation is redefining the way consumers buy and use healthcare by developing new products, treatments, and business models that integrate separate healthcare organizations or activities. Midaxium understands that moving the needle in CV care is not simple. It takes vision and leadership, and it requires bridging technology, innovation, and care delivery. Midaxium experts are helping programs across the country shape the future of cardiovascular care delivery. Through education, organizational performance solutions, and advocacy, we are evolving disease management, innovating virtual care, driving the data revolution, and redefining access and team-based care. Let's transform cardiovascular care together. Get started at Midaxium.com/care transformation. Welcome back. Our guests, Dr. Ed Fry, Cathie Biga, and Dr. Jerry Blackwell, have been looking back on 20 years of transforming cardiovascular care together. So now let's dive just a little bit deeper. We've been having a great conversation. So from physician-hospital integration to major legislative reform to a global pandemic, the Midaxium and ACC community has always found a way to meet the challenge of the day, continually pushing the needle forward towards innovation. So let's start with Dr. Fry. Can you share a specific story that stands out to you as the moment you realized your community was truly transforming care?
Well, I would say that it was not a specific moment, but it was probably an experience that unfolded over a several year period of time. I'm in and Cathie also is part of our system as well, but I have leadership responsibilities for a large service line that has a national footprint. And it became very daunting to consider how do we take all of the great education, science, sort of the nuts and bolts of how to do things and why we should do things that's generated from ACC and deliver that at the patient level. And that was one of the great challenges. And through a process of system-wide process improvement, quality improvement, could bring that that blueprint, so to speak, to the general contractors, also, so to speak, in the form of the clinicians, to be able to deliver on optimal care to our patients. And it was at that moment I realized that we really had a unique opportunity, particularly as it relates to the interplay between ACC and Midaxium, even before we became one entity, that each brought unique attributes to the delivery of healthcare. And then the proof of that came as we watched over a several year period of time, as we could use the ACC tools, such as the registries and other quality measures, to be able to demonstrate that we were actually improving care. We were actually improving the lives of our patients through this unique synergy and this unique collaboration. And then it just became so exciting when we got to the point that we realized that these two organizations together would be much stronger together than they were independently. And I think the last 3 years have really borne that out. And I'm really looking forward to the next 3, 10, 30 years to see what happens.
Yeah, Dr. Blackwell, what about you? Because I mean, in all the stories, very patient-centered.
Yeah, again, I just love hearing Ed's comments about this, and needless to say, I share them. I would say the thing that has influenced me and sort of, it's both an aha moment and what I find, or what was very compelling to me in this whole journey, was actually connecting the dots between the data-driven American College of Cardiology on the clinical guidelines, clinical care, science, education, and quality, which, by the way, is a common thread for most cardiovascular specialists that drew us into the specialty, the notion that we keep score and that we're data-driven. And then really fully realizing, it took me a few years, but fully realizing the depth and power of the Midaxium organizational database, MedAccess. And so now we have this combination of science, educational quality, data-driven, keep and score, and then organizational performance metrics in the form of MedAccess, being data-driven on the organizational performance side, bringing those two together for a common good, which is the benefit of the patient and, by extension, society. So it really, I think that would be the story, the tie that binds for me. And again, as a clinical cardiologist involved in the ACC for many years, the notion that Midaxium and ACC could get together, man, it's peanut butter and chocolate, peanut butter and jelly, whatever you want to say. It's a good combination.
I love it. Peanut butter and chocolate. That's a great, that's a Reese cup.
It's
Good combination. Cathie, what about you? Can you think of that moment?
Well, yeah, I think it comes together. What's so interesting to this, the moment was when Suzette Jaski was presenting a patient with atrial fibrillation, presenting to the system. And I'll never forget the graphic. It had the patient coming in from the emergency room, from the clinic, into their specialist's office. So several different ways the patient can present, and 1,000 ways of treating that poor patient with nothing being consistent. And it was like, wait a second. We need to put together the guidelines from ACC and the business model that Jerry just talked about and figure out the best way to deliver care to these patients that is clinically driven, that's evidence-based, that's not, this way because maybe that's how I was trained, but how it is today in 2021. And then taking that dyad leadership of that administrative individual and the clinical leader, the physician, and designing a team around that. I mean, that's that aha moment that we're just not going into an office and doing blah, 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 blah. We're actually transforming how that patient's going to be cared for to the best evidence. And I think it was exemplified again with the pandemic. I mean, good gravy. I remember March 13th, like it was yesterday, and all of a sudden that veil comes down on a Friday. And by Monday, our practices were perhaps closed, but completely given virtual care on a dime. Mm-hmm. We were able to transform how we delivered care to patients so the patients stayed safe in their homes while we were trying to figure out what it was we were dealing with. And we had the offices open for that critical imaging that we may have needed to do. But in the span of 24 hours to completely change the way we deliver healthcare, cardiovascular care, is still amazing to me. The challenge is we change quickly in a crisis. Then we find ourselves pulling back into our comfort zones. So I hope through this podcast, we can encourage people to stay out of your comfort zone so we can continue some of that stuff that's much better for our patients in diagnosing and treating their disease process and in that care. But I'll never forget that AFib patient, because I think we're all going to have AFib at some point. And there is the best way of treating that. And I hope that I'm the recipient of that because of the ACC Midaxium partnership.
It's interesting to hear this, because without that synchronicity, 2020, March 13th, and beyond would have looked a lot different potentially.
Very true.
So we have been taking a look back on the past 20 years. So now let's look forward. Can you share your vision of how the Midaxium and ACC community will look 10 years from now, in your opinion? Cathie, I'll start with you.
Well, if I had stood at 2010, if you figure Midaxium started 99, 2000, that first 10 years was like the roaring 20s. We were incorporating imaging, nuclear, lots of different devices, retooling how we did our practices. 2010 happens with physician hospital integration. 2020 happens with COVID and a pandemic and moving to value care. I just can't, the rapidity of change just continues to amaze me because I keep thinking we can't change faster, and yet we do. So that next 10 years, I hope what Ed said comes to fruition. I hope we actually get some of that value-driven methodology that we all know is the right way to deliver healthcare. We get past all of the legislative and regulatory barriers that really exist, that we get to a true health equity and access point. So no matter where you live, no matter what color your skin is, that you have access to solid care, whether you're a male or a female, that no matter what your ethnicity is, that you have that ability to get solid cardiovascular care. And I think Midaxium, as Ed loves to say, we're kind of the Home Depot. We go and we pick up the clinical guidelines and such from ACC and we deliver it out to the masses so that it doesn't matter if I'm in rural or urban, but that care is delivered to me in a way that prolongs my life and enhances my quality of life. And then the next 10 years, I just can't imagine. My grandkids have to help me get on YouTube now. I just can't imagine how we'll be communicating later. But I think embracing that change is so critical. So I know Jerry's going to lead us into that next millennial. And I don't know that we know what's behind door number 3, but I'm ready to open it.
Oh, wow. I like your future. It's bright. I'm going to live in it with you. All right. And Dr. Fry, what about you?
Well, I think, as always, Cathie has articulated really, a vision that I think we all can aspire to. I would say as we look forward, and certainly we have to approach everything as Yogi Berra did, that it's very difficult to predict, to make predictions, especially about the future. But I think we can look forward and say that there's some headwinds that we can see, and we need to realize that those headwinds, just as we have seen over the last 20 years with Midaxium, can become opportunities. And I would outline them as being a move to value, recognizing the importance of population health and moving to value, equity, and obviously the pandemic has exposed challenges and problems that we know previously exist, but really are magnified now related to health equity. And along those same lines, then access. And then lastly, as Cathie touched on, just the power of innovation, both in terms of the amazing opportunities to use innovation, but the challenges that imposes just in terms of its user friendliness and costs associated with that. But I couldn't think of a sort of a better situation for us to be in to draw on the power of ACC in terms of the science, the innovation, the education, the advocacy, really giving us all the tools to deal with those challenges. And then the operational non-clinical competency expertise that lies within Midaxium. And I think as we go forward over the next 10 years, we will see that those lines blur and that we'll see that each is synergizing off of the other to create a better way for us to deliver care. So I'm really looking forward to seeing that. As I like to tell my partners, I won't be a provider of those services at that time. I likely will be a consumer of those services. And I'm very optimistic in terms of what the product is going to be when comes time to use those.
We're only saying 10 years, Dr. Fry. So I'm not sure.
Yeah. Well, you started off saying that, we're taking a 20-year look back, and we were all 16 years old when we started this. Oh. So, it's a long way to go.
You're right. Yep. Dr. Blackwell, kind of chime in here, and I think about last year and it felt like, we all stopped, but then it was like, boom, boom, fast forward. I felt like 10 years, but now hopefully things can slow down just a little bit because we had to pivot so quickly. But how do you see that next 10 years?
Yeah, I would probably be wise to just not say anything and let Ed and Cathie's comments stand because they're so wise and have done so much through the years. I would say that Ed's last comment about the lines becoming blurry between the science, education, quality, and the organizational performance, the reason they're becoming blurry is because they should be one and the same. If you look at this through the eyes of the patient, those things that optimize the way we deliver care, again, back to Cathie's atrial fib aha moment, the way we deliver the care, the organizational performance, as well as being sure that we're doing it at the highest value via science, education, quality, those lines should not be there at all. It should be with the patient at the center. Those should be joined. And I'm quite confident that's going to continue going forward. Obviously difficult to look 10 years down. One of the things I hope folks feel from this is, look, tomorrow's going to be better than today. And for most things that we do, if we're honest about it, the future is going to be better than what's gone behind. There'll be smarter people coming behind us. We'll do things better. There's a few common themes, I think. One thing you've heard over and over and over is if you just had to pick one word, and that is team. We realize that more people with different skill sets working together as a team is a good thing. So that's clear. But the things that I believe that we're going to see going forward is I believe that we're going to take this incredible information age that we live in, where there's this incredible doubling time of medical information, and get away from that and start really being focused and turning it into actual wisdom for the benefit of those we serve. So it won't just be about the information, it'll be about how we use it. I believe that we're going to, this is not stepping out very far, we're going to be more and more interconnected. And I believe that the consumer, the patient, is going to become much more tightly woven into their own care than has happened before. I think the consumer is going to become better engaged, better prepared to engage. And I think that that's going to be a hallmark of what happens as we go forward. I think that this notion of the industrialization of medicine is only beneficial if it's hand in hand with professionalism. And I believe that we're going to be able to do that, inform the consumer in this information and wisdom age. And tomorrow will be better than today.
Well, I know we talked about 10 years from now, but 2022, we probably kind of have an idea about what that looks like and what everyone can expect. So let's start with Dr. Fry. Sneak peek of maybe just what our colleagues can look forward to next year, which is literally a blink away.
Well, this is very timely because actually before we got on, I was actually going through thinking about for our service line to look back over 2021 and look at just the incredible innovations that have developed through the new guidelines that are being published. We just had one blockbuster set of guidelines. We'll have another in December. We've had new drugs that have been approved by FDA that have major cardiovascular benefit. And we really look forward to this next year in terms of seeing those developments and research really coming to fruition, how they will impact our patients. And I look forward to the challenge of how do we translate those discoveries and those advances into implementation and optimization and delivering on the quadruple aim for our patients, and also delivering in terms of improving the life and well-being of our care team members, which is a critical piece of the quadruple aim. So that's what I'm looking forward to in 2022. And recognizing that 2022 will probably be similar. We'll see another set of really blockbuster things that will develop, and we'll be looking forward to 2023. How do we implement them then? So this continuous cycle of improvement, I think only snowballs and continues to become more and more exciting, as well as more and more rewarding.
What about you, Dr. Blackwell? Just looking forward to the next couple months.
Sure, it's interesting. It may be a little easier to look forward a few years than it's going to be to even look to next year, just because the pandemic continues to overhang a little bit. And I know none of us want to pretend like we know what's going to happen. That really can change. But I really echo Ed's comments. And the only sort of additional point or exclamation point, I believe that we're going to see just an ongoing, relentless drive to control costs in a in a value environment. In other words, cost alone is that you've got to be sure the quality is maintained or improved. And a truism in cardiovascular care medicine in general is that the highest quality care almost always costs less, not more. And I believe that we're going to see organizations that just relentlessly say, look, you drive down that cost and keep the quality where it is. I believe that that's going to be an ongoing focus. Again, I serve an area of that's predominantly rural in Northeast Tennessee, Southwest Virginia, so I'm particularly attuned to that. But I can tell you, in 2022, the sort of rural pressures are very similar to what's going on in a highly urban environment. So I think there's going to be relentless attention to getting rid of waste / excess cost.
All right, Cathie, what do you think?
Well, we're not done. I think the government, Baltimore specifically from a regulatory perspective, that triple aim, quadruple aim is out there for a reason. Delivering cost with the best outcomes in the lowest cost environment is going to be critical. There are going to be a million advocacy challenges that we need to hit face forward, face on. We need to make sure we're involved. You know, the old saying that if we're not at the table, we'll be on the menu, which is never a good place to be. So I think advocacy is going to be critical. While Ed is getting those blockbuster guidelines out, I'm going to try to figure out how to get everybody paid, how to make sure our patients have the right access with their health insurance plans, that none of them understand how it works and they can't figure out why they've got high $5,000 deductibles and such. So that component, I think, from an administrative perspective is so critical as we head on. I agree with Jerry. I think my 10 years is very rosy. I think when we're dealing with what's the next 12 months, that's where sort of that, hair goes up on the back of my neck. Like, how am I going to get through this next 2 months? And we know what's right here. How are we as a team going to figure this out? And that's where, if Midaxium is not in person, I don't know what I'm going to do, because I need my buds, and we need to sit there and have a glass of wine and figure out exactly, how we're going to approach some of this. Web is nice. It's nice seeing you guys. But, really that human interchange is so very important. So the next 12 months, I want to see people in person. The summit, I think we're pretty sure is going to be in person. So that will be awesome. So hope to see everybody in Washington in February, and then in Austin in April, or wherever we're going to be, but just somewhere. But I think the next 12 months are going to be challenging. I won't, it keeps me up at night. I think there are some issues with site of service those cost pressures are going to continue to kind of come at us, and we need to figure out how to deal with them.
All right. Well, this was fabulous. We're just going to blow Omicron, this new variant, away. And if we can get rid of that, I think we can kind of move forward. All right, Dr. Fry, Cathie, Dr. Blackwell, thank you all so much for sharing your time, your stories, of course, your expertise today on Midaxium HeartTalk. Thank you.
Thanks for having us.
Thanks, guys.
All right, so that is it for this episode. If you liked it, please tell your colleagues and let them know that they can subscribe to Midaxium HeartTalk on Apple, Google, or wherever they get their podcast. If you would like to send us a note directly or suggest a topic, email us at hearttalk@midaxium.com. Thanks again for listening.